In this video, I'm going to address a very common question that comes up pre-surgery and a genuine concern for people who are post-op, to the point where actually people don't have the surgery for a gastric sleeve or bypass because they think that maybe this is something that's going to impede their life long term. And I'm here to say that yes, there are things in our control that we can do about loose skin, and there are also things out of our control. I'm going to give you all the information in this video. My name is Harry Hedges, the Bariatric PT. Please hit subscribe because I'm going to do 2 videos like this every single week going forward to help people with their bariatric surgery journey. And loose skin, like I say, it's a key question. And I think the first thing to say and get it out on the table early is this surgery will enhance your life. It will lengthen your life. It will give you better quality of life. And none of those things have anything to do with loose skin. I understand why aesthetically loose skin is something to be aware of, but surely we need to be thinking long term with regards to our health and our life here. And that loss of body fat, that loss of weight is something that's going to help your body thrive in so many ways. And as I say, I've had the pleasure of supporting many patients. Yes, loose skin can be a factor, but I've not had one patient say that I regret the surgery because of the loose skin. And that is because of all the other benefits they get if things are put into practice correctly and they utilize their aftercare correctly and they utilize the support and build new habits in place. That being said, let's give you some details around loose skin. Things that are out of your control and why it's going to vary a little bit from patient to patient. Your age. People who are older tend to get more loose skin compared to younger people because people just get looser skin when they're older. And it's something that skin strength is not going to be as strong. And it's something just to be aware of. If you are an older person having this surgery, loose skin could be more of a factor. Genetics. Genetics play a role. People do have different skin types, and that elasticity of skin is going to vary from person to person, but based on their genetics. And as I say, there's nothing you can do about that. You'll find that some people get more in their tummy area. You'll find that some people might get some in them around their legs. And that again is genetic based. People store fat in different parts, but it's usually sort of tummy is the stubborn part that people tend to be most aware of. And the analogy I always use is if you're a lady and you're giving birth, it's quite rare that someone begrudges the loose skin because they've had a child, and that's a wonderful, wonderful thing. And I think surgery can be, obviously it's very, very different, but it can be similar in the sense of it's a wonderful process. We shouldn't be put off by just the loose skin. I don't think women don't have babies because they're worried about loose skin, but then again, I'm a man, so I'm going to stay in my lane on that one. Gender can be a feature as well. You do find that women tend to get more loose skin than men. Also, and this, you could argue this is in your control, out of your control. It depends how it manifests itself, but if you lose weight quicker, and there can be this illusion sometimes that more aggressive weight loss is quicker, we want to get the weight loss as quickly as possible, it's very likely you're going to get more loose skin. And that is because there's a loss of muscle mass occurring during that time. Yes, fat loss will be occurring for sure, but that loss of muscle mass is something that can really occur. And the easiest example is going back to the age side of things. As people get older, one of the reasons they get loose skin is that unfortunately we all get weaker the older we get if we don't have the right practice in place. And that's where loose skin can be a byproduct of that. And it's a similar thing with this. Yes, if you lose lots of body fat, if you're in a big, strong calorie deficit, you're losing lots of body fat, but you'll be losing muscle mass as part of that. Your muscles go into what's called a catabolic state, and that's not actually the goal. Slower, steadier weight loss, you'll find that patients will have less loose skin, and that should be celebrated, not just for the loose skin, but the fact that we are buying into consistency rather than just, I want aggressive weight loss now, because that mindset always causes problems long term. Now let's go to things that we can control. So optimal protein levels. We know protein is fantastic at protecting muscle mass. Again, it is understood. Check out my protein video that's on my page. It is understood that in those early stages, protein is going to be difficult. We ask for sort of 60 grams for that reason. Every gram of protein is 4 calories. That's 240 calories, which I think people tend to be eating 600, 700, 800 calories. So we want to aim for about 33% of our day. That's a good place to be, but with a view to get it to 80 to 100 grams of protein over time, because we can eat more food, that is something to be aiming for, and protein will absolutely help that loose skin side of things. People talk about supplementation and things like collagen, which is very, very heavily advertised to help loose skin. To be honest with you, just hit your protein amounts, whether it's collagen, whether it's whey, or whether it's through whole foods. Let's make sure, I think prioritizing whole foods is very valuable, but complement with supplementation. I wouldn't get too drawn into products that help loose skin. I think just hit your protein targets as best you possibly can. And the second thing that is within our control is exercise. Now, a proactive approach to exercise. We can't lift weights until 6 weeks post-procedure for a sleeve or a bypass because we need our incisions to heal up. But I promise you now, from helping lots and lots of patients, the ones that bring strength training in a proactive manner, i.e. they're doing it at 6 weeks. They're not doing it because they've got loose skin, so therefore we're going to do strength training. They're doing it in that early stage when it becomes available. I think a gym is a really beneficial piece because you've got more equipment, you've got more angles that you can work with, you've got an environment that you can thrive in. Of course, that compared to a band and a dumbbell at home is not going to be as beneficial. But if we can bring exercise into play and we're doing strength training in a very sensible manner, everybody can strength train, because I'm not saying you have to go as heavy as possible. I'm saying you want to start light, find out what you can do, and then build it up over time. Your body's a wonderful machine. It adapts, it gets better at things that you do consistently, and that is the same with strength training. You will find that will help your muscle mass greatly, and that will also help your loose skin in a big way as well. So things out of your control, things very much in your control. From experience, if you do what's in your control, you'll get lots of other benefits as well, getting stronger, getting fitter, that people tend to care less and less and less about the loose skin because they did all they can do. If you skip these two things, it's not a good idea for your health to do those things anyway, then naturally you're going to be maybe a bit more reactive to loose skin and think, maybe what could I have done in the past? So while not everybody gets it, people will get more or less based on what's in your control, what's out of control. Let's just concentrate on what's in our control. But on the things that are out of control, let's not worry about those, because I promise you there are so many benefits behind weight loss surgery that are beyond loose skin. My name's Harry Hedges. Please hit the subscribe button for more videos like this, and I'll look forward to catching up with you very, very soon. Goodbye.